So in one form or another, I have been encouraging medical education in rare diseases since 2011 when I was at Barts and London Medical School. And our aim is to drive an attitude change towards rare diseases amongst medical students and now also doctors in training, hence a slight name change. So we all know that rare diseases affect 3.5 million people in the UK, which is a huge patient population. And yet the word rare continues to have a stigma in medical education. There's an understandable reason for this due to time constraints and each individual disease being rare. But what we're trying to say is if you look at 3.5 million people together, they have shared experiences, shared challenges, that if you then put them together, they're people that need to be considered in education. So we believe that telling doctors about the relevance of rare diseases early in their career is fundamental for their patient relationships later on when they're a GP and someone walks in and they're a rare patient. They cannot know about every rare disease, but they can understand the common challenges that I'm talking about, how to access patient groups and what the patient groups can provide. I grew up alongside a patient group, so I know very well about them, but a lot of my medical student colleagues didn't when I was learning. How to communicate with the expert patient that isn't just someone who's gone and Googled and you know, they've come in, they know what they're talking about and you may know less than them, and how to have that communication. So Medics for Rare Diseases is our next incarnation. It's a not-for-profit organisation, and so in the past we've always worked in collaboration with other charities, and now we're going to try and go it alone. But we're very grateful to the LSD Collaborative who have looked after us for a long time, and we've got sponsorship from Sobi, Biomarin, Inventiva and Ultragenics for this. And we've got a website that goes live tomorrow that I built, so feedback is okay. It's www.m4rd.org. On Thursday, I'm going to see some of our brilliant medical students up in Birmingham with Birmingham Children's Hospital holding their second annual Rare Disease Training Day. And I went to the last one, and I just thought they were brilliant. And it's amazing what medical students can do. And I think what we want medical students to do, and doctors in training, is bring back the core of medicine, which is curiosity and compassion, that can, at times, just go out the window and for understandable reasons, but it doesn't mean we can't try and push it a bit. Other things we work on are the Royal Society of Medicine conference, and Melita Irving has been a supporter of us for a long time. Find the Cure essay, and I'm glad that Marianne's here today, and she's the winner. She's speaking on Thursday as well. And we would like to produce our own learning resources that are aimed at poor, tired medical students and doctors that are focused for them, like snippets that are going to target them in those unique needs that they have. So if you're a consultant and you've got some keen, or not keen, but they could be keen students, or junior doctors, please just send them our way. Or if you're a student, a doctor, or if you're a patient group who's got access to people that we could work with, we will basically take any way that we can to talk to the doctors of the future about rare diseases. So thank you.